Hi everyone! In this video we want to discuss the treatment of sore throat. Not every sore throat needs treatment with antibiotics because most sore throats have viral etiologies. They are viral infections. They are self-limiting and we just need some supportive care like antitussives or something like that. But in case of streptococcal pharyngitis, we prefer to administer antibiotics to prevent rheumatic fever in the future. But who should receive the antibiotics? When should we suspect streptococcal pharyngitis? Let's see. The presence of fever greater than 38 degrees of Celsius receives 1 point. The absence of cough receives 1 point. The inflammation and redness of the pharynx receives 1 point. Lymphadenopathy or tenderness of the lymph nodes around here, around our neck, receives 1 point. What about age? Age between 5 and 15 receives 1 point. Age between 15 and 45 receives 0, and age equal or greater than 45 receives -1, a negative point. Each patient receives 2 points, should receive the antibiotics. For example, the patient with fever and absence of cough receives 2 points and should receive antibiotics. Hope you enjoyed this video. Please like, subscribe and share, and don't forget to ask your questions in the comments. Thanks.